I wanted to make this video for the ladies of a certain age to help you with perimenopausal symptoms, potentially menopausal symptoms as well. To be clear, this isn't going to eliminate the symptoms at all, but it's going to help you manage, and it's going to help your body to stay in a relative state of homeostasis rather than being all over the show. Other things that it can help with are high levels of stress, chronic fatigue, and all of these other kinds of things. Okay, so without further ado, first things first, we need to gain access to our nervous system and then trigger the particular part of our system that we want to work with, which is going to be the endocrine system. So the first part is to gain access. And to do this, you close your eyes and then make contact with that access point for the cerebellum. So you gently, very gently, touch your eyelids and at the same time swipe from the lumpy bit of your skull down to C1, like there, just for a second or two. Then you press your tongue to the roof of your mouth, just behind your teeth, and make contact with GB20, which is the very middle of your head, right in here. And again, swipe the back of your head. So those three contact points tell your brain we're going to be accessing the endocrine system, which is our hormonal system. Okay, so we're now prompting that, and then we're going to elicit some energy to those points to help them work better. So maintaining contact there. You'll rub roughly the center of your throat where your thyroid is. You can tap if you like, but that feels a little bit weird. Rubbing is absolutely fine. To find your adrenals, go one finger in your belly button, and then you come up 1 inch and out 1 inch. And again, gently rub. For your reproductive, come below the belly button 2 inches and then out a little bit further. So we swipe roughly where our ovaries would be-ish, across the sacrum, the lower part of our back here. And then if you want an extra prompt, press in here on the thumb pad. Once you've done all three of those access points, you'll tap the top of your head. So that recalibrates the main glands that are using hormones and crossing over the messages and stuff that are giving you symptoms in perimenopause. So you keep the tongue pressed to the roof of your mouth. Okay, and when that's done, tap the top of your head. So that kind of closes that down. So if you imagine gaining access to that, it's like opening your phone. Pressing the GB20 tongue in the back of your head is pressing the settings. Rubbing on the thyroid, the adrenals, and the reproductive is going into the apps that are malfunctioning. Tapping the top of your head is updating the cache and everything else. It's just giving them a reboot. And then you allow that system to rest for a moment. So that's via the endocrine system. We can also elicit a positive effect on those glands through muscle swipes, which are less invasive, but will also kind of make sense if you're feeling aches and pains in these particular areas of what else could be going on, because quite often muscle pain isn't relative to the muscles themselves. Sometimes it's a deeper layer. So the muscle associations with thyroid are pretty close by. So we would look at supraspinatus and the teres, which are here. So the muscles that surround your scapula. And so if you're carrying a rucksack, the muscles that the straps would be touching. The easiest way to gain access to those muscles is to swipe your neck, rub, rub. So 3, 4, 5, pick a number, doesn't matter. Give them a nice swipe. So you know when you get out of a shower and you're drying your skin with a towel, it's that kind of level of swipe tension, okay? Do you need to go in a specific direction? No, not really. You just need to make contact. Do you need to do any points just before? No, you can just go straight in. So this one for the thyroid. For the adrenals, it's glute max, your glute medius, your glute minimus, and the piriformis. So they're all really close together in one area, and you can see why hip and back pain can be correlated as a symptom for menopause. Okay, we can take both our hands and literally swipe our hip and bottom area all round by 5, 6, 7 times. It's completely up to you. The sartorius, so side of our rib cage coming down, and then our calves. So we just rub the back of the lower limb, one at a time if you like. You can do both at the same time, whatever works for you. And last one is the adductors. So from the inside of the knee all the way up. I like to go in one area, one direction, because it's kind of going to help the lymphatic system all at once. So while you're doing all of these self-care things and trying to improve your body's own system, why not hit as many different systems as you can all at once? So those muscle swipes again, neck and where you would carry a rucksack, glutes right through, down the sides, calves. You can do one leg at a time, you can do both legs, adductors, boom. Now sometimes just that contact is plenty. It makes you feel warm, in a good way, not in a hot flush kind of way, and it just gets everything back up to threshold. How long do these swipes and corrections last? How long is a piece of string? It really depends on how well your brain is recalibrating towards these resets. It also depends on other lifestyle elements that you've got going on. But this is kind of like a quick hack to get you feeling better. How often should you do them? As often as you can remember, to be perfectly honest. Once a day is okay, is ideal. 3 or 4 times a day, even better. Once or twice a week, it's all good. Whatever you can manage, all right? The more you do it, the more your body is going to help you and manage the symptoms.